"Are you the man who decides if sick people get to go home?" The little girl asked it without flinching. She was maybe 7 years old, standing in the fluorescent wash of the hospital corridor at 11:47 p.m., holding a paper cup of vending machine hot chocolate with both hands. She looked directly up at Sterling Vance, Chief Executive Officer of Meridian Health Partners, with the particular fearlessness that only children and people with nothing left to lose ever manage. Sterling had been walking toward the parking garage. He had just spent 11 hours in back-to-back meetings about quarterly authorization denial rates, network adequacy compliance, and the pending acquisition of a regional HMO in the Gulf Coast. His driver was waiting. His dinner had gone cold 3 hours ago. He had a 6 a.m. flight to Washington. He stopped. The girl's name was Penny. He didn't know that yet. He just saw a child standing alone in a hospital corridor at midnight, and something in his chest went very quiet and very still. "Where's your mom?" Sterling asked. Penny pointed down the hall. "She's talking to the lady at the desk again. She's been talking to the lady at the desk a lot tonight." Sterling looked. 40 feet away, a woman stood at the nurse's station, her back straight and her voice too low to carry. She was wearing scrubs, the kind you wear when you work in a place like this, not when you're visiting. Navy blue, slightly faded. Her dark hair was pulled back in a loose bun, and a few strands had come free. She pressed one hand flat on the counter, steady, like she needed an anchor. Sterling recognized the posture. He had seen it in boardrooms. It was the posture of someone who has been saying the same thing for too long to too many people who keep saying no. He looked back down at Penny. "Is your mom okay?" he asked. Penny considered this the way children consider things that are too complicated for simple answers. She took a careful sip of hot chocolate. "She's tired," Penny said. "She gets tired when she has to fight." The woman's name was Dr. Marin Solis, and she had been on her feet since 7 that morning. She wasn't a patient. She was an attending pediatric oncologist at St. Augustine Medical Center in Minneapolis, which meant she had spent her Tuesday watching children be sick and trying to make them less so. Tonight, the child she was fighting for wasn't on her official roster. He was 8 years old. His name was Tobias Kern, and he was the son of her colleague and closest friend, who had died of a pulmonary embolism 14 months ago and left Tobias in Marin's guardianship with a diagnosis of acute lymphoblastic leukemia and a Meridian Health Partners insurance policy, with an authorization pending status that had been pending for 19 days. The drug was called Nexavir. It wasn't experimental. It had been FDA approved for pediatric all for 3 years. The clinical evidence was unambiguous. Tobias's oncologist, not Marin, because she had recused herself appropriately, because she followed the rules, had submitted the prior authorization request 3 weeks ago. Meridian had sent back a request for additional documentation, then a request for peer-to-peer review, then a notification that the case had been escalated to the Clinical Review Committee, which met on Thursdays. It was Tuesday. Tobias had been waiting 19 days for a drug that every physician who had reviewed his chart agreed he needed. His most recent blood work had come back that afternoon. The numbers were moving in the wrong direction. Marin was not by nature a woman who made scenes. She was precise. She was methodical. She had published 31 peer-reviewed papers and trained more than 100 residents over a 17-year career. She did not raise her voice at nurses' stations. But she had also promised Tobias's mother, in a hospital room very much like this one, that she would not let him fall through the cracks. And she had meant it in the way you mean things when someone is dying and looking at you, and there is no one else in the room. So she was here. It was nearly midnight. Penny was drinking vending machine hot chocolate because Marin hadn't eaten since noon and couldn't leave to take her daughter home, because the regional medical director for Meridian Health Partners had agreed, finally after 4 phone calls, to be in this building tonight. Someone from the executive team, someone with actual authority over the authorization queue. She hadn't been told who. Sterling watched her from the corridor. He had come to this hospital because his VP of Clinical Operations had called him at 9 p.m., which his VP never did, and said, in a very careful voice, that there was a situation at St. Augustine that he thought Sterling should handle personally. Not a complaint. Not a media thing. Just a physician who had requested executive escalation and hadn't stopped requesting it until someone said yes. Sterling had come because he had learned, in 12 years of running health insurance companies, that when a single physician pushes that hard, there is usually something worth seeing. He watched her press her palm flat on the counter. He watched the nurse look at her with the expression of someone who is sympathetic and powerless simultaneously. He watched Maren close her eyes for exactly 2 seconds, then open them and keep talking. He walked toward the nurse's station. Maren heard footsteps and turned. She saw a man in a charcoal overcoat, 50-ish, with the particular grooming of someone who had come from a long day of important meetings. She saw the Meridian Health Partners lanyard in his breast pocket. "Dr. Solis," Sterling said. "I'm Sterling Vance. I'm the CEO of Meridian." Something moved across Maren's face. Not relief, not gratitude. Something considerably more complicated. "I know who you are," she said. "I've been trying to reach your company for 19 days. "I know," Sterling said. "I read the file on the drive over." "Then you know that Tobias Kern is 8 years old, and his all is progressing, and the drug his oncologist prescribed 3 weeks ago is sitting in an authorization queue while your clinical review committee waits for its Thursday meeting." "I know that too." Maren looked at him, steadily. "Then I'd like to know what you're going to do about it." Sterling opened his mouth. The answer he had prepared, the measured, liability-conscious, technically accurate answer about clinical review protocols and utilization management guidelines, died in his brain and his mouth, because Penny had followed him down the corridor. She was standing 3 feet to his left, still holding her paper cup, watching him with the calm, unnerving attention of a child who had learned to read adult faces very carefully. "Are you going to help Toby?" Penny asked. Sterling looked down at her. "Penny," Maren said quietly, "why don't you go sit in the chairs?" "I want to hear," Penny said. She looked at Sterling. "He's my best friend. He taught me to play chess. He's not very good, but he tries really hard." She paused. "He hasn't been able to play for a while because he gets too tired." Sterling was quiet for a moment. "How long have you known Tobias?" he asked. "Since I was 4, Penny said. "His mom and my mom were best friends. His mom died." She said it plainly, the way children state facts that adults flinch from. "So now my mom takes care of him," she promised. Sterling looked at Maren. Maren was watching him with the exhausted precision of someone who has been making the same argument for too long and is waiting to see whether this particular person is different from the others. "The prior auth was submitted 20 days ago," Sterling said. "Not a question." Maren said. "His oncologist, Dr. Patricia Huang, submitted the complete clinical file including pathology, response data, and 3 supporting studies. Your company requested additional peer documentation on day 7. Dr. Huang submitted that on day 9. Your company escalated to committee review on day 12. The committee meets Thursdays. It was not put on last Thursday's agenda. Why not?" "Because," Maren said, her voice very level. "The case coordinator who handles committee scheduling was out sick, and no one covered her queue." Sterling stood very still in the fluorescent hum of the hospital corridor. One person out sick, one uncovered inbox, one 8-year-old waiting. "I'm going to need your conference room," Sterling said. The authorization came through at 1:23 a.m. Sterling made 4 phone calls, his medical director, the chair of the clinical review committee, the VP of operations, his own assistant to pull the Kern file and confirm nothing was missing. It wasn't. It had never been missing. It had been sitting, complete, in a queue that no one had looked at, because someone had called in sick and no one had thought to check. Maren stood in the doorway of the small conference room and watched him work. She hadn't asked to be in the room. Sterling hadn't told her to leave. She was simply there, arms crossed, her stethoscope still looped around her neck, watching. When Sterling hung up the last call and the confirmation number appeared on his screen, he looked up. "It's approved," he said. "Effective immediately. Dr. Huang can proceed in the morning." Maren was quiet for a moment. She uncrossed her arms. She pressed her fingers briefly to her mouth, and then she lowered her hand and her face was composed again. "Thank you," she said. She said it like it cost her something. Sterling looked at the authorization confirmation on his screen. He had seen thousands of these. He had built the systems that generated them. Tonight, for the first time in a very long time, a number on a screen felt like it was connected to something breathing. "Dr. Solis," he said. "Can I ask you something?" She waited. "How many cases like this do you think exist right now? In our network?" Maren looked at him steadily. "I don't have your data," she said. "But I can tell you that Tobias is not the first patient I've had to fight this hard for. And I'm a physician with the time, the access, and the professional authority to push back. Most families don't have a Maren Solis making calls on their behalf." Sterling was quiet. "Most families," Maren continued, "have a diagnosis and a phone number and an automated hold message and a clock." She picked up her bag from the chair. She moved toward the door, then paused. My colleague, the one who died, Tobias's mother. Her name was Dr. Lynn. She was a hospitalist here for 9 years. She knew exactly how to navigate insurance systems. She knew the CPT codes and the clinical criteria and the appeal pathways. Marin paused. When she got sick herself, she spent the last 4 months of her life fighting her own prior authorizations. She knew the system better than most people ever will, and it still took everything she had. Sterling said nothing. So when you ask how many cases like this exist, Marin said, the answer is, more than your Thursday committee has time to review. She walked out. Sterling sat alone in the conference room for a long time. On the wall behind him, someone had taped a child's drawing, probably from a pediatric ward activity. It showed a house with a yellow sun and 2 figures holding hands. Under it, in careful crayon letters, I want to go home. It was Penny who found him still sitting there. She appeared in the doorway in her coat, backpack on her shoulders, ready to go. She looked at Sterling with calm assessment. My mom says we can leave now, Penny said. Toby's going to get his medicine tomorrow. That's right, Sterling said. Penny nodded seriously. She cried a little in the bathroom. She thinks I didn't notice. She paused. I noticed. Sterling looked at the little girl in the doorway. She was holding her empty paper cup. She had carried it all this way. You can throw that away, Sterling said, nodding at the cup. Penny looked at it. I know, she said. She didn't throw it away. She looked at him for a moment longer, with the particular gravity of a child who has something to say and is deciding whether the adult is worth saying it to. Toby asked me once why his medicine is so hard to get, Penny said. He said the doctors keep saying it'll work, but then nothing happens for a long time. I didn't know what to tell him. Sterling had no answer for that either. I told him it was like when you're waiting for the school bus, Penny said. You know it's coming. You're just standing in the cold. She looked at Sterling one more time. I think you're the one who drives the bus, she said. Then she turned and walked down the corridor to find her mother. Sterling's 6 a.m. flight left without him. By 7 a.m., he was in his downtown Minneapolis office, which his assistant had opened early without being asked because she had learned, in 6 years of working for him, to read the particular quality of his voice at 5:30 in the morning. By 8 a.m., he had his VP of Clinical Operations, his Chief Medical Officer, and his Head of Utilization Management on a call. I want to know, Sterling said, how many prior authorization requests are currently in our queue past day 14? There was a pause. Ethan, his CMO began, and then stopped because Sterling's name was not Ethan, and she had begun to say something, wrote and corrected herself. Sterling, our standard review window is. I know what our standard review window is, Sterling said. I helped write it. I want to know how many cases are past it. Another pause. The sound of keyboards. Across all lines, his VP said carefully, we're looking at approximately 430 active cases past the 14-day mark. Sterling was quiet. How many of those are pediatric oncology? I'd have to find out today. And I want to know how many of them have complete clinical documentation that's been sitting untouched because of a queue management issue, an absent coordinator, or a meeting that didn't happen. His head of utilization management cleared her throat. Sterling, I want to be transparent with you. Our review capacity is. I know what our review capacity is, Sterling said. I set the staffing ratios. That's actually the problem I want to talk about. The call went quiet. I'm going to need real data, Sterling said. Not the data we show the board. I want the average time from submission to decision, broken down by diagnosis category. I want denial rates by condition type. I want to see how many appeals we receive versus how many we approve. And I want to know how many patients abandon their appeals before we ever rule on them. His CMO said, slowly, Sterling, that data is going to show things that are difficult, too. I know what it's going to show. Show it to me anyway. The data arrived in a 47-page internal report by noon. Sterling read it alone in his office. He did not share it with PR. He did not route it to legal for review. He read it the way you read something when you are trying to understand something rather than manage it. The numbers were precise. They were also, read in a certain light, a portrait of invisible suffering at very large scale. Average time to authorization decision for complex oncology cases, 22 days. Appeal abandonment rate, 34%. The report noted, in a small footnote that Sterling had to read twice, that abandonment rate spiked sharply for cases involving patients over 72 and under 12. He thought about Tobias Kern, 8 years old, too tired to play chess. He thought about what Marin Solis had said. Most families have a diagnosis and a phone number and an automated hold message and a clock. He thought about Lynn Kern, a hospitalist who had understood the system better than almost anyone, and had spent her last 4 months fighting it anyway. He picked up his phone. "Get me Dr. Solis," he said. Marin answered on the third ring. She was, Sterling suspected, already back on the ward. "Tobias started his first infusion this morning," she said, before he could speak. He asked his nurse if the medicine was going to taste like anything. She told him it goes in his arm. He said he hoped it tasted like pizza anyway, just in case. Sterling found himself almost smiling. "Dr. Solis, I want to ask you something. You're going to ask me if I'd be willing to consult on a policy review." He paused. "How did you know that?" "Because you read the file before you came last night," Marin said. "Which means you're someone who actually prepares, and because you asked how many cases like Tobias's exist, which means you're not satisfied with handling one. And because you've called me at," he heard her check something, 12:17 in the afternoon when I would expect a CEO to be in a lunch meeting. "I canceled the lunch meeting." "I know," Marin said. "I looked you up this morning." Sterling was quiet for a moment. "I have an internal report," he said. "The authorization timeline data, the denial rates, the appeal abandonment figures. I want someone to look at it who understands what those numbers mean clinically. Someone who will tell me what I'm not seeing, and you want that to be me. You told me last night that most families don't have a Marin Solis making calls for them," Sterling said. "I want to build a system that doesn't require one." There was a pause on the line. "I have conditions," Marin said. "Tell me." "I work as an independent consultant. I report my findings publicly, not just to your board. If I identify specific systemic failures, those findings go into a public access report that your company cannot edit or suppress. And my name is on it." Sterling had known, from the moment he walked into that hospital corridor, that this was the kind of conversation that ended careers or changed them. He had watched his board chair's face go carefully neutral when he'd mentioned the Kern case at 7 a.m. He had felt the particular quality of silence that settles over a room when people are calculating risk rather than listening. "Agreed," Sterling said. Another pause. Longer this time. "What made you call?" Marin asked. Not hostile. Genuinely curious. Sterling looked at the 47-page report on his desk. He looked at the footnote about abandonment rates. He thought about a little girl in a hospital corridor at midnight, holding an empty paper cup, telling him that she thought he drove the bus. "Someone told me that the people waiting for a decision know the medicine is coming," Sterling said. "They're just standing in the cold." Marin was quiet. "She's 7, Sterling added. "I know," Marin said. "She told me what she said to you. On the drive home very matter-of-factly." A brief pause. "She also told me she thinks you seemed sad." Sterling looked out the window at the Minneapolis skyline, gray and bright with winter light. "She's perceptive," he said. "She grew up watching her mother fight," Marin said simply. "Children learn what they live around." The board meeting was a Thursday, which Sterling noted with something close to dark irony. He presented the report himself, all 47 pages. He did not summarize or soften. He walked his board through the average case timelines, the abandonment rates, the pediatric oncology queue. He showed them the footnote. The room was not comfortable. "Sterling," said the board chair, a man named Douglas Hartwell, who had been in health insurance for 30 years and had the careful, preempt face of someone who has learned to see liability before he sees people. "You're describing a system that's functioning within regulatory parameters." "I'm describing a system," Sterling said, "where 34% of the people who appeal our decisions stop appealing before we give them an answer. I want to know why they stop, because they find other coverage, because their situation changes, because they run out of time," Sterling said, "or energy, or they don't understand the process, or they decide that fighting us is taking something they need for something else." Hartwell looked at him steadily. "What are you proposing?" "3 things," Sterling said. "First, we create an emergency review pathway for pediatric oncology and other acute cases. Guaranteed 72-hour decision from complete submission. Second, we hire and train a dedicated patient navigation team, not a call center. Actual case navigators who proactively reach out to families with pending authorizations past day 10. Third, we publish our authorization data quarterly. Approval rates, denial rates, timelines, appeal outcomes publicly. The silence that followed was the specific silence of people doing calculations. "The navigation team alone," said the CFO, "represents significant overhead. So does our appeal rate, Sterling said, and so does our legal exposure if this report becomes public without us having already acted on it. That shifted the room. Sterling watched it happen. He was not proud of the mechanism, but he was not above using it. There's also, Sterling said more quietly, the question of what we're actually for. Hartwell looked at him. We exist, Sterling said, to reduce risk and manage cost. I understand that. I've built a career on it. But we are a health insurance company, and 19-day authorization queues for approved pediatric oncology. Drugs are not a cost management strategy. They are a failure of the purpose. Hartwell was quiet for a long moment. You could have handled the Kern case quietly, Hartwell said finally. One approval. No report, no presentation. I know, Sterling said. Why didn't you? Sterling thought about a paper cup, about crayon letters on a hospital wall, about a woman pressing her palm flat on a counter at midnight, steady like she needed an anchor. Because the next case is already in queue, Sterling said, and the one after that. And I don't want tonight if a physician to call me personally every time. The measures passed, not unanimously. Hartwell abstained. 2 board members voted against the public reporting requirement and lost. The navigation team was operational within 60 days. The emergency review pathway went live in 45. The first quarterly public authorization report was published on a Tuesday in early spring, which was, Sterling noted, not a Thursday. Dr. Maren Solisina's name was on the independent advisory board. Her findings in the first public report were pointed and specific, and, in 2 cases, required Meridian to change internal procedures that had been in place for 8 years. The board was not happy. Sterling had expected that. What he had not expected was the call he received on a Wednesday afternoon, 3 months after the hospital corridor, from a number he didn't recognize. He answered. This is Tobias Kern, said a small, careful voice. I'm calling because my Aunt Maren said it was okay. Sterling sat back in his chair. Hi, Tobias, he said. Hi. A pause. She said you're the one who helped get my medicine approved. Your doctor did most of the work, Sterling said. She'd been fighting for you for a long time. I know, Tobias said. She does that. Another pause. I wanted to say thank you. Penny said I should call, instead of write a letter because letters take forever. Sterling looked out his window at the gray Minneapolis sky. You're welcome, Tobias, he said. I also wanted to tell you something, Tobias said, because Penny said you seemed sad when she saw you. Sterling waited. My mom used to say that the hardest part of being a doctor wasn't when things went wrong, Tobias said, in the careful, deliberate way of a child reciting something precious. She said it was knowing what right looked like and not being able to get there fast enough. Sterling was very still. She said that to me right before she died, Tobias said. I think about it a lot. He paused. I thought maybe you might think about it too. Sterling didn't speak for a moment. Your mom sounds like she was remarkable, he said finally. Yeah, Tobias said simply. She was. On a Thursday morning in late spring, the light came through the windows of the community health center differently than it did in a boardroom. Softer, less certain of itself. Sterling was there for the first public meeting of the Independent Patient Access Advisory Board, which would be, going forward, a quarterly open session where Meridian's authorization data was presented to physicians, patient advocates, and members of the public who had been affected by coverage decisions. The room was not full. It was never full for a first meeting, but it was not empty either. Maren arrived 5 minutes before the session was called to order. She was wearing a simple blazer, her dark hair loose today, and she carried a folder thick enough that she'd clearly been working since early morning. She set it on the table and looked across the room. Their eyes met briefly. She nodded. Not warmly. Maren Solis was not, Sterling had learned, a woman who performed warmth she didn't feel. But there was something in it that was not hostility. He nodded back. Near the back of the room, in 2 folding chairs, sat Penny and Tobias. Penny was drawing something in a notebook. Tobias was watching the room with the particular alert attention of a child who has spent a great deal of time in institutional spaces and has learned to read them. He looked better than he had in the photograph Maren had shown Sterling. Not well, not yet, maybe not for a long time, but present, eyes clear. He caught Sterling's eye across the room. He gave a small, serious wave. Sterling raised his hand in return. The session was called to order. Maren opened her folder. The work was not finished. It was barely started. The data she was about to present would be uncomfortable. The conversations it would generate would be harder. Sterling had already been told, quietly and with precision, that two large institutional investors were reconsidering their positions, and that Hartwell was not going to stop pushing back. He knew all of this. He also knew that in a row of folding chairs near the back of the room, a boy who had learned chess from his dying mother was watching to see what happened when someone with power finally walked through the door and stayed. Sterling picked up his pen. He was ready to begin.